Good morning, everyone. Thank you so much for joining us today. We are so excited to have you for our second State of the Eastside event to talk about what's happening on the Eastside in regards to development, investment, housing, and sustainability. The unprecedented global crisis from the COVID-19 pandemic ultimately made it impossible for us to host our Eastside business briefing in person. So, like everything else in our lives, we have adjusted to the new normal of meeting virtually. Today's topic is how to cope with mental and physical health. Typically, we hold these once a quarter, but because this is such an important topic, we decided to move it up on our calendar to discuss today. We have three amazing panelists that I'm going to get to in just a bit, so we will talk to them in just a little bit. There is no doubt that COVID-19 has severely impacted our lives over the last few months, and indeed, the focus on police brutality, racial issues, giant hornets, and now an African dust storm. 2020 has been a lot. So during this time, SAGE has had to evolve its way of operating at all levels. We're working hard to meet the needs of our community as we work remotely. Our staff have been working hard to meet with board, clients, businesses, all on the East Side. And these times are challenging for all of us, and I could not be more proud of my staff and of our community for their strength. But lately, there has been an uptick in cases, and this in itself is causing stress and fear. It's been a time of sacrifice on behalf of our essential workers, families, students, as well as a time of loss for many families who have lost the battle with this virus. I'm asking you to please join me in a moment of silence for our local families and those worldwide who are suffering. Thank you for that. Now, before we get started, I want to thank our sponsors who allowed for us to host this event today. So we have Broadway Bank, BBVA, Frost Bank, University Health System. As well as I'd like to thank our board members, Robert Melvin, Juan Mata, Joanne Sosa, Stephanie Ash, Jeffrey Arndt, KJ Fetter, Father Kevin Faust, Adrian Jackson, and Sandy Villaseñor. So now just a real quick update about what we're doing here at SAGE. SAGE continues to focus on sustainable growth to build the community up from within. And today's Eastside Business Briefing is a reminder of the work we have collectively achieved and what we're doing in response to COVID-19. So today, SAGE is committed to providing San Antonio's Eastside with the latest resources and information. Our newsletter has been updated and is chock full of important information, resources, opportunities, job fairs. Whatever we can provide as community resources will be in that newsletter. So if you're not getting that, make sure that you do. Given the unprecedented impacts of COVID-19, we also have been serving continuously our back office program. So SAGE continues to help people with finance, with mentorship, with any type of assistance that our small businesses may need. And then within the last couple of weeks, we have helped several people, not weeks, months. It seems like weeks, but months we have been helping people fill out their Paycheck Protection Program applications. Next, we partnered with the Bexar County Strong program, and that was in conjunction with the Westside Development Corporation, Southside First, and the North San Antonio Chamber, where over the period of 2 weeks, we hosted 3 online trainings and helped more than 200 small businesses apply for this funding. And next, we helped with a small business bingo, which was also in conjunction with the Westside Development Corporation in Centro San Antonio to help locally owned small businesses that have been some of the hardest hit during this pandemic. Next, we have our storefront grant, which applications are due tomorrow. So if you are interested, please contact us. This past year, we awarded $120,000 to 16 Eastside small businesses, and we will do so again this year. And then, last but not least, I would love to share with you a piece of artwork that we incorporated with a local artist. His name is Hector Garza, and he wanted to share with us his vision. So we're all speaking out in different ways, and through his art, he wanted to support Black Lives Matter. And so he actually painted that and has been working with us on that program. So we're very excited to have Hector Garza and for the rest of our local young people that are doing such great work in the community. So now that you've had SAGE's update, let's get started. So as a reminder, your audio and video are not active. Questions for our panelists today have already been submitted, and you can ask a question in the Q&A box, and time permitting, we will answer them. So please allow me to introduce our panelists. We're very excited to have 3 guests, and in alphabetical order, I will introduce them. Then they will each have time to speak to the group individually. After all 3 have spoken, we will bring the panel back up to answer questions that have been submitted. We've got some amazing panelists today, so forgive me for the length of their intros, but it was so difficult to condense them because they are such amazing women. So ladies, thank you for being here, and we're gonna go ahead and get started. So our first panelist that I would like to introduce is Mrs. Velma Gettelman. She has over 20 years of experience in the criminal justice and mental health field. She recently joined Crosspoint as Chief Operating Officer. She was previously employed with Bexar County for 20 years, most recently as the manager of the Department of Behavioral Health. Mrs. Gettelman received her bachelor's degree in psychology from Our Lady of the Lake University. Her first master's degree is in counseling, and her second master's degree is in human resource management. Continuously pursuing her passion for learning, Mrs. Gettelman was also an adjunct professor at San Antonio College. She has held various leadership positions and provides extensive expertise in planning and curriculum development. Mrs. Gettelman has been licensed in Texas as a licensed professional counselor and as a supervisor of counselors by the Texas State Board of Professional Counselors. As a licensed professional counselor supervisor, Mrs. Gettelman has extensive clinical experience in direct service providing treatment for adolescents, families, and adults. So you can see why Ms. Velma Gettelman was a great selection for this panel. So now I'm going to turn it over to Velma, and she's going to speak to you about her programs and some other topics that she'd like to address with the group. Thank you, Velma.
Thank you, Ms. Knight. Yes, as she stated, I am a licensed professional counselor, but currently I am the Chief Operating Officer at Crosspoint. And for those of you who don't know, Crosspoint is located on the East Side on Yucca Street, and it's a transitional residential facility and support services. Our mission is to provide safer and stronger communities by empowering individuals to lead productive lives. And our vision at Crosspoint is to be the model of personal and community restoration. We help several different populations transition back into the community. We have several programs, and we serve some of the most vulnerable populations. I'm going to go over a couple of those populations we serve and let you know how to get involved if you'd like to. One of them is our homeless veterans that we serve in our veterans program. We also have our behavioral health transitions program, where we serve individuals with mental health and/or substance use issues that are coming out of psychiatric facilities. We also serve women and their babies or pregnant women who are in recovery from an opioid addiction in our Casa Mia program. In our Esperanza Court program, we serve individuals that have been human trafficked and now part of the court system. We also have our residential reentry center program, where we serve individuals that have been incarcerated and are now reintegrating back into the community. And one of our newest programs that we're extremely proud of that's going to open July 13th is our Women's Wellness Center. That's where we will serve women who are homeless veterans, as well as women who also have mental health or substance use issues coming out of the psychiatric facility. One that I think the audience may be interested in or may need help is our outpatient treatment center. We provide mental health services as well as addiction treatment services, and we do provide free services for District 2 residents that don't have insurance. During this pandemic, we have seen a lot of anxiety within our residents. As I stated, we are a transitional living facility, so we have people living. We have not been able to shut down. We are an essential personnel, and we're so proud of our staff for just, handling the situation well. Of course, some of our residents have mental health issues, so you can only imagine their anxiety and depression, sometimes even suicide ideation is a lot stronger. What we have done that I think is very important is that we have weekly informed our staff, send out weekly emails just for them to self-care. Because I'm sure you can be aware of, if you're not taking care of yourself, it's very hard to take care of anybody else. So we provide resources to them weekly. We provide our employee assistance program. We do have counselors on staff. So if any of our staff members need that, we want to make sure that they're healthy. As far as our residents and staff, we have definitely taken all the measures that we could to keep them safe, which is wearing masks, providing hand sanitizer, having posters all over about social distancing. And we have been also trying to help our residents stay busy in healthy ways, because when the city did shut down, they weren't able to go anywhere. So they were, feeling a little cabin fever. So we've tried to help them, teach them coping skills, allow them to go outside. And it's important for us as well, because, and to limit news, because of course, when we watch the news, that can cause our anxiety, the fear. We don't know. This is new for everybody. And what's important to remember is it's okay to be scared. It's okay to not be okay, but as long as you're not doing it alone. I think as long as we talk to our friends, talk to our family, and if we need to, it's okay to reach out to a mental health professional, just to process what's going on. So really, I just want to end by saying I did provide a lot of resources that I'm sure is going to be sent out to you, Ms. Knight, informed. I do want to give you the Crosspoint number for that outpatient service that's free if you need counseling services. That phone number is 210-225-0864. And if you want to know a little bit more about Crosspoint, our website is cpsatx.org. Thank you so much, Ms. Knight, for having me here, and I'll answer any questions that you have. Thank you.
Thank you, Velma. We are pulling back up. Thank you so much. We appreciate that introduction. And so the next speaker that we have to welcome is Dr. Stacy Ogbeide. We're very excited to have her. And so Dr. Ogbeide, it's on you.
Great, thank you. And again, thank you for having me here with these other two fantastic panelists here. And so just a little bit about me. I am a board certified clinical health psychologist. And so what that means is that I have particular training and interest in working with individuals who are dealing with and battling various health conditions, chronic health conditions like diabetes or chronic pain, but also coping with different health issues that show up in life, such as getting diagnosed with cancer and what that does to someone's life. And so I am a faculty member. I'm an associate professor in the Department of Family and Community Medicine at UT Health in San Antonio here in town. And I predominantly work in the family medicine residency, and our clinic is located downtown in downtown San Antonio at the Robert Brady Green campus in the clinical pavilion right across the highway from the Children's Hospital of San Antonio. So we're located in the Family Health Center, and what we focus on, particularly in our clinic, for patient services, is providing primary care services, as well as we embed behavioral health services into the primary care clinic. So our clinic is really unique, where you can get your physical health needs met by meeting with a primary care provider, and we have many to choose from there in our clinic. And we also have behavioral health consultants in the clinic as well. So you could actually come in to meet with a primary care provider and also see a behavioral health consultant on the same day right after your PCP visit. And so we really capitalize on your time. We know people are very busy beings and have lots going on. So we really try to offer you wraparound services for your physical and behavioral health needs in one visit. And so some of the trends that we are seeing in our clinic related to COVID-19 is really COVID-related stress, similar to what the previous panelist had just talked about. But we're seeing it compounded with physical health conditions, like, for example, chronic pain. People are experiencing more chronic pain flare-ups because of the additional stress on their body from the emotional distress of COVID. Maybe you haven't got to see loved ones due to physical distancing, or just the sheer stress from the financial stress. Maybe you've lost a job or you were furloughed recently, and so that's an additional stressor on you and your family. And so we're seeing a lot of that manifest physically. And so somebody may come into the clinic or have a telephone visit or a video visit and talk to their PCP about, I've been having a lot more trouble sleeping, or I'm having a lot of headaches and I didn't really have this before, or I'm having a lot of stomach aches. So a lot of stress can manifest physically. And so we're seeing a lot of that as a way that the body is trying to cope with all the different stressors that everyone is experiencing in different ways due to the pandemic and what is out there. Something else I really want to bring attention to briefly, and I'll can talk about it during the Q&A part too, is something that's called adverse childhood experiences, or ACEs for short. Maybe you've heard of ACEs before, maybe you haven't. So if you haven't, guess what? You have now. So you can cross that off your to-do list today that you heard of this. But essentially what this is, there are a series of really difficult stressors, traumatic stressors that can happen to a child before the age of 18. And what we see is that the more stressors that people have, whether it's been emotional abuse, physical abuse, neglect, domestic violence, which we're also seeing rates of that increase all around the US, all around the world, it can lead to the development of chronic health diseases as an adult, or the worsening of chronic health diseases as an adult. It could lead to the development or worsening of behavioral health or psychological problems as an adult as well. And so I want to bring that to everyone's attention, especially how COVID, as well as what's going on racially in our world with African Americans specifically, that all of those things that everyone is experiencing, or many people are experiencing, is an example of an ACE, or an adverse experience, especially for our young folks who are under the age of 18. So that's something to be mindful of right now, and something that whether it's seeing a behavioral health provider, whether it's seeing your primary care provider to take care of some of those chronic diseases that have been put on the back burner due to COVID-related stress, I would definitely encourage people to think about how to take care of yourself, your loved ones, your children, your family members, especially during a time of COVID and some of the racial tension, because these things in and of itself are a huge stressor that people are going through on top of your daily stressors. So more to come with that, but I'll stop right now to give time to the other panelists.
All right. Thank you so much, Dr. Obide. And I failed to do your introduction. I have to go back and do it. I was so excited about hearing you speak that I just overlooked it. So if you don't mind,
Sure.
Everyone that's here joining us, you have to hear about her amazing story and just a little bit of her background. So I will make sure I do that for you, Melissa. But Dr. Obide is a board-certified clinical health psychologist and a board-certified specialist in obesity and weight management. She is the director of behavioral health education and an associate professor with the family medicine residency at UT Health San Antonio. She has also a cross appointment in the Department of Psychiatry, Division of Behavioral Medicine at UT Health San Antonio, and serves as the Integrated Primary Care Behavioral Health Track Coordinator for the Psychology Residency. Dr. Obide serves as a consultant for the Integrated Healthcare Initiative of Mental Health America of Greater Houston. She is the 2018 recipient of the Wingspread Honoree Award through the Collaborative Family Healthcare Association, the 2019 recipient of the Association for Psychologists and Academic Health Centers Early Career Psychologist Contributions Award, and the 2019 recipient of the Integrated Care Champion Award of the Missouri Psychological Association. She recently served as the co-chair for the Primary Care Behavioral Health Special Interest Group and is co-chair for the 2017 CFHA's annual conference, and currently serves on the board of directors for CFHA. Dr. Obide has published in the area of integrated primary care and behavioral medicine, has over 100 conference presentations, and teaches graduate courses in behavioral medicine and integrated primary care, behavioral health at Our Lady of the Lake University here in San Antonio, Texas, as well as the University of Texas, San Antonio. Her professional areas of interest include the primary care, behavioral health, consultation model, behavioral medicine, health psychology, and I'm sure I'm saying geropsychology.
Perfect.
And the education and training of health professionals. So as you can see, ladies and gentlemen, we've got amazing panelists. So Dr. Obide, pardon me for missing you, but I was just so excited about hearing what you were going to say. So again, thank you so much. Now, our next speaker that I would like to introduce is Dr. Melissa Walker. And as she's brought up on the screen, Dr. Melissa Ann Walker is a family medicine physician and the owner and founder of Carroll Clinic for Family-Centered Healthcare in San Antonio, Texas. Carroll Clinic is named for her late mother, Mrs. Carroll Williams Walker, and is the name with an acronym. So the C stands for care, the A stands for attention, the R stands for respect, the O for oneness, and the L for loyalty. She believes these and so many other attributes were possessed by her mother. I'm sure they were. Dr. Walker is a graduate of Grambling State University, where she received both a Bachelor of Science in Biology and a Master of Public Administration and Health Services. Prior to attending medical school, she did graduate studies in neurobiology at the University of Texas here in San Antonio. She received her medical degree from Midwestern University and completed residency at the University of Texas Medical Branch in Galveston. She travels both nationally and internationally, providing care and education. Along with a team of 12 nurses, she journeyed with Destiny Ministries to Southern Africa and Botswana. She is the regional chair for the National Medical Association and an assistant professor at the University of the Incarnate Word School of Osteopathic Medicine. And upon reading her bio, I also learned that she is one of my sorority sisters with Delta Sigma Theta. Hello, Soror, and welcome. It is your turn to speak.
Well, thank you so much, Tuesday. Yes, ma'am, I'm a 30-year Delta. I just have to plug that in. So anyway, thank you to Sage, to Miss Knight Tuesday for the invitation. Thank you to Dr. Obide and Miss Gettelman for being co-panelists with me. I am very excited to share with you what I know of mental health as it relates to this COVID experience. One of the things that I failed to share with Tuesday is the fact that I do a caregiver symposium. We've been doing it for the last 7 years, and it's called Heal the Healer. And one of the things about Heal the Healer is that it targets self-care for caregivers, and that either a professional caregiver or a non-professional caregiver. But what I'd like to address today is the professional caregiver as it relates to COVID-19. You know, there are so many people that come up to me or send me something and say, you know, thank you for being on the front lines, and you know, you had organizations like McDonald's providing free meals to first responders and caregivers, those of us that are on the front lines. But I think one of the things that is really missed is the mental health or stress aspect of those who are providing care during this pandemic. And so that's one of the things that I would like to address, not so much in the aspect of statistics, because for those of you who may have logged on, if you are experiencing it or living it, you know what I'm talking about. And so you don't need stats to tell you that you are being stressed because of the amount of work, the fear that goes along with what you're doing. And so anyway, I'd like to talk about that. Some of the information I am going to give is from my credible source, and that would be the CDC. I think that it's important that you find one good source of information and stick to that. I think that's going to be the answer to a question later on, but I would say to do that. The CDC acknowledges that those of us who are caregivers, who are healthcare personnel or first responders, that we, just by the mere fact that we are those people that are providing care, that we experience a lot of stress, a lot of anxiety, a lot of fear, and other strong emotions as we provide care during this pandemic. One of the things that it emphasizes is what do you do? How do you recognize that you are feeling that stress that goes along with providing care? And it talks about, feelings of irritability or anger, feelings of, denial, even the lack of motivation. Those of us who became, physicians, nurses, social workers, or mental health providers, we did that because, as I believe, that medicine is and caring is a calling. You think that you choose it, but I believe that it chooses you. Well, I don't think, and I know I can speak for myself and probably for so many others, that we came into this arena ever believing that we would be experiencing a pandemic. And that's exactly where we are. And I can tell you, as a person who is not just a healthcare provider, but I'm also in private practice. So, the impact on myself, thinking about from a financial standpoint, will I be able to continue practicing with, so many, healthcare offices that are having to shut down? And, thank God for the ability to do virtual medicine or telemedicine, but things are really different right now. So the impact of having to, have hands-on with people who have the virus, but also dealing with the financial impact of what it looks like when your business and your business revenue is going down. So I think that those are things that, we really don't think about a lot when you talk about someone who is a caregiver and or a first responder. Other things that the CDC wants us to recognize as like feelings of lacking, the motivation, but also feeling sad and depressed, decreased sleep. Anyone who knows me, I joke all the time that sleep is overrated. I say that you don't need that much sleep, and that's probably because I've conditioned myself not to sleep that much. But when I want to go to sleep, I do want to sleep. And so for those of us who are healthcare professionals, look for signs like that. Look for the fact that you are not sleeping as well. Okay, now I've said that, but what do you do about it? I think that recognition is the first thing, but also seeking out from your organization what it provides as far as, mental health strategies or resources like Ms. Gettelman mentioned earlier. What are the resources that are available to you by your organization? And so I just want to emphasize that not just thanking the healthcare provider for what he or she is doing, but also helping to recognize that, those of us who are doing it are also experiencing some of the same stressors that you as the lay public is. Another thing that I would like to bring up really quickly is for those that are experiencing the stress of not because of COVID illness, but because of COVID, and they're having to make adjustments to, even funerals. I have talked to either patients and or friends who were not able to either visit a loved one in the hospital, non-COVID illnesses, that loved one passed away, and then they were, tasked with, having a different kind of funeral. When you are grieving, it is very important to have someone to, be there for you, to hug on you, and all of that stuff. And the Washington Post, talks about, there was an article entitled, the article was how funeral homes and funeral directors are having to rethink final goodbyes. And, I don't know if many of us think about that, but how they're having to rethink the whole funeral aspect of this COVID-19 thing. So I just wanted to emphasize that those are some of the things that I wanted to put on people's minds. You may be experiencing it. And as I said, Ms. Gettelman talked about the different resources. Sage will share those resources with you, but I think it's very important that you, the provider, recognize the impact of COVID on yourselves. So that's what I have to share, and I think that questions are going to come up, and if any of you have anything else, I would gladly answer those.
Thank you. Thank you so much, Dr. Walker and Dr. Obide and Mrs. Velma Gettelman. Thank you so much for those introductions and for those tips. And so now we're going to bring everybody back up on the screen. And we have some questions that were sent in, and I'm hoping that we can get to them. If we do not get to your question, please feel free to shoot that over to us, and we will make sure that we get those answered. But in the time that we have some questions, and we're just going to go in order to some pre-selected questions. And if we have some time, we will definitely get to the end. So my first question I have is for Velma. Velma, you had mentioned some of the resources that are available for mental health and for the uninsured and underinsured. So what can one find, or where can they find these resources? And part B of that question, are any of them free?
Yes, so thank you, Ms. Knight. So yes, there are several resources. I'm sure we're all aware that we can say there's not enough capacity for mental health. There's always a need for that. But I do want to say that there are resources for uninsured and underinsured. Locally, it's the local mental health authority, which is the Center for Healthcare Services. You can look at their website, or I can provide you the crisis helpline, and as well as Dr. Walker mentioned earlier, SAGE will send out all these resources so you don't have to quickly write them down. But the crisis helpline for them is 223-7233. And that is if you're going through a mental health crisis, and they'll hook you up with services, whether it's outpatient treatment or they want you to quickly come in. One of the other best places I can say where you can find a lot of resources is through Bexar County. They have a Bexar County mental health department. And they have a resource guide that is local to San Antonio, and they provide substance abuse resources, mental health resources, housing resources, all sorts of other different resources that you can get on their website, as well as SACRD. That is SACRD.org. And that's basically stands for San Antonio Community Resource Directory. And they have several resources. You just type up your zip code, type up what your need is, and it'll show you what's available in your area. And you asked, some of them, do they take uninsured or underinsured? And yes, a lot of those, and you would have to find out, they do work on sliding scales. But like I said, the local mental health authority, they are the one resource that we know that they, as the local mental health authority, will take you. There's also the domestic violence resource, and I wanted to just mention that. I believe Dr. Obide, and please forgive me, I just said your name wrong. She mentioned that during this pandemic, we have seen an increase in domestic violence. And that is unfortunate, but it is very true. During the stress, just a healthy individual is under stress, severe stress, financial, worried about tomorrow, family members, their jobs. So domestic violence has risen, and there are several resources. And I just want to mention a quick one, real quick, a local one, which, as I stated earlier, is the Family Justice Center here in San Antonio. And that phone number is 210-631-0100. There's also national hotlines that I know Ms. Knight will send out, whether it's the Domestic Violence National Hotline, the National Suicide Hotline, the Veterans Crisis Line. There's a lot of help out there. So really, I just want to say, just call. Don't worry about the stigma. That is one positive thing I do want to mention, is that during this whole COVID-19 pandemic, mental illness is now being talked about more public. I've been in the business for many, many, many years, and that was one thing that in different cultures, we can't talk about it. You just don't say if you've got a mental illness, and we all know 1 in 5 people will be diagnosed with a mental illness during their lifetime. So that's a lot of people, but there's not a lot of people talking about it until now. So I'm very grateful for that. You hear movie stars, you hear athletes, you hear people now publicly talking about their anxiety and depression that they're going through because of this pandemic. So that is one positive thing I will say, is that I'm hoping the stigma of getting help ceases, because we all need help at one point in our lives, and it's okay.
Thank you so much, Mrs. Gettelman. That's exactly right. And I think you spoke to a lot of people with that statement. And so my next question is for Dr. Walker. And along with what Mrs. Gettelman mentioned and all of the changes that are happening at once that we've talked about over and over and over, what advice can you give to someone from keeping them from being overwhelmed by all the decisions and precautions we have to take right now?
Well, much of what we said has been kind of heavy. I wanted to, when I thought about this, I wanted to say something that may have been a little lighthearted. I have something I call, I don't have it personally, but something I call the Wanda syndrome. And I don't know if any of you remember Good Times, but there was a character on Good Times. Her name was Wanda, and she loved attending funerals. And she would go to funerals all the time, and she'd cry and she'd talk about this. And so I want to encourage people not to assume the Wanda syndrome. And what I mean by that is inundating yourself with so much negative information. I'm not saying untrue information. I'm just saying so much about death and all the things that has gone along with this COVID-19 pandemic. I would encourage you, again, as I alluded to before, find one trusted resource, maybe a national resource, online and or via television, and then find a local resource. Watch your local news and find out what's going on in your area, San Antonio. When you listen to all the stuff across the country, you can internalize that. So if you're listening to, New York, and you're hearing about all that's happening and all the, the illnesses and deaths and, things in New York, and then you're going to California, and then you're going to this region of the country, it is most important that you listen to what's happening to you locally and respond accordingly. And it's simple as this. I remember early on, friends would contact me and they would say stuff like, "Ooh, I heard you wasn't supposed to take Tylenol." And, "Ooh, I heard you're not supposed to do this." My response to every question that was given me was, wear your mask, wash your hands, and practice social distancing. If you know nothing else, those three things is enough. Do those things and follow those recommendations, and prayerfully you will be okay. But inundating yourself with a lot of information can only help to elevate your stress level.
I can say that from someone who agrees with you 175%. I know that's not a thing, but it is for me. So I completely understand. So thank you for that.
Sure.
My next question is for Dr. Obide. With all of your experience in what you've worked on and who you've worked with, we see that there's a lot of resources available, but how do we get people to take more advantage of these services, free or not free, but what are offered right now during the pandemic? So what advice do you have about that?
Yeah, that's a real issue even prior to COVID, getting people to engage. I think Ms. Gettelman talked quite a bit about stigma, and I think that is still a thing. It will still be a thing even after the pandemic is over. And so that is a barrier to behavioral health care still. I think it's definitely getting better. We have data to support that it is getting better. People are seeking out services, but that's still an issue for sure. And I think the other thing that we need to keep in mind too is an individual's readiness to engage in any type of treatment has to be there, whether it's going to their primary care provider. There's still a lot of people that don't have a primary care provider for a multitude of reasons. It's not always financial reasons. And so I think that's the thing we need to keep in mind, that getting ready to make a change it's a spectrum. And everyone goes through this level of ambivalence with any change that we all make. You can probably think of a time when you were thinking about making a change, even just building more exercise into your daily life, and how many people struggled even with figuring out, well, how do I actually make time to do that? or purposefully make time in my schedule because it's important for me. We all go through a level of ambivalence. And so some people are still in that ambivalence, figuring out, is this the best thing for me or not, even in a pandemic? And so I think that's something else to keep in mind, that everyone's readiness levels are different. So services could be free and right in front of someone, and they still wouldn't want to engage in services for a variety of reasons that we may not ever know. And so I think if we can be patient and keep offering those services free, or you use your insurance to get access to those services, I think the biggest thing is just us in the healthcare field continuing to offer those services whenever we have contact with patients, individuals, letting people know where they can get services, making sure it's readily accessible for people. So when that day comes, when they are ready, it's available for them. They don't have to hunt and seek it out. So that's just something for us, all of us, to keep in mind in terms of just any type of behavior change.
Thank you so much, Dr. Obide. So the next question is actually for the entire panel, because this really is your opinion that we'd love to have. And so feel free to answer in whichever order you like, or I can actually just call you out in order. But the next question again is for all of you. And then the next few ones have come in throughout this time. So we'll ask those as we finish up with this question. So again, this is for all panelists, and it is, how do I offer emotional support to friends, family members, or coworkers who have been quarantined? And part B of that is also, what can I do for myself to support myself? Because a lot of us as women want to do everything for everyone else. Men, you're not excluded, but it is something that I can say, speaking as a woman, that we want to support everyone else, and sometimes we're forgotten. So again, the question is, how do I offer emotional support to friends, family members, or coworkers who have been either quarantined or affected? And so I'm going to go in reverse order as we did from the introduction. So Dr. Walker, you're first, Dr. Obide, and then Mrs. Gettelman. So Dr. Walker?
Oh, sure. I think that it's really important to acknowledge if someone lets you know that they have been affected by the virus. I think that's really important to acknowledge them, but don't treat them like it's like it's a death sentence. And I say that because recently one of my friends shared with a group of us that someone had come to their home and then later found out that they had the virus. And so she was a little irritated because she felt like the person should have been a little more responsible, in their visiting their home. And I've even heard, just recently from some other people that their getting the virus was secondary to, they are doing all the right things, but secondary to someone else. But having said that, no one needs to be penalized for that. I think that we can do our best to support them. When you say emotionally is one, but I'm a believer in doing. So if that person needs you to pick up something for them, or even assist, just say if they have children and they're having to quarantine, assist them with help, with caring for their children, or, providing, like I said, food or other resources to them. We're in a pandemic. We all need to recognize that all of us are going through something. We all have limited resources as it relates to this. And in the recognition, do whatever you can to help someone else. That's my take on that.
Thank you so much, Dr. Walker. Dr. Obide?
Yeah, Dr. Walker really hit on a lot of the important points about reaching out for help and not stigmatizing the person once they have COVID and are in the recovery process. The biggest thing I would add to that is, and you had mentioned this, Ms. Knight, too, in terms of many times we as humans get in this fix-it mode because we are in a time where almost everything is really outside of our control. And so that level of feeling helpless is really at the forefront of for a lot of us, And so many times we might grasp at anything we can control, whether that's trying to quote unquote fix something for someone, and just realizing that not everybody needs or wants that. That's not how they receive care from others. And so don't underestimate how far a text can go to someone, a short FaceTime video call to someone. It can be quite isolating to be quarantined or to be in the hospital, and seeing people suited up and gowned up to be around you is quite difficult. And so bringing gifts and bringing food and helping with groceries are fantastic for those who like that. But some people really just want a phone call. Some people really just want to know that you haven't forgotten about them. And so please don't forget to send that text message out, whether it's once a week. Set up a time to do a recurring Zoom call like this to let them know that they are on your mind.
That is wonderful. Thank you. I know I appreciate a lot of those as well. Mrs. Gettelman, so sorry.
I like that. No, thank you. And both panelists have definitely spoken about things that are definitely important and needed. I'm gonna focus back on ourselves, because Ms. Knight, you are correct. I believe as women, we are God-made caregivers, and it's in our being to want to take care of everybody else and forget about ourselves. So I think it's very important that we just sit back and think, what are some of the things that can help us decompress, help us unplug, that make us feel relaxed, whether it's going outside, bird watching. There's so many different things, journaling, that are healthy. And the reason I stress that is because I think, as I stated previously, before we can take care of anybody else, we have to make sure that we're taking care of ourselves. And that's one of the things I try and tell our Crosspoint staff regularly is take care of yourself, go and plug. One of the things I love to do is go outside and listen to the birds, just nature, and focus on the things I'm grateful for. Because if we focus on things, as Ms. Walker said, the news and the resources or the sources that we're watching, a lot of it is very scary and some of it is not true. So if we just take time and focus on things that are true and that we're grateful for, that's a way for us to stay positive. And I believe it was already touched on what we can do with family and friends. I think it's very important we stay connected. We are social beings, and I believe that without us having that touch or that social that we're so used to, it does affect us. So I'm so grateful for Zoom and now FaceTiming and all this new social media stuff we're able to do, because I think it is important that we stay connected, especially to our parents, our loved ones, friends, people that are truly, truly quarantined, where they are stuck in their house, or their nursing home. I think it's important that we stay connected through virtual.
Thank you for that. And that was a perfect segue into our next question. And so our next question is for the entire panel, and whomever is interested in answering this, it wasn't for a specific person, but what are some warning signs and risk factors that older adults and possibly adults with disabilities may be experiencing emotional stress or anxiety? Because again, since all of us are dealing with this as a brand new thing, how do we know that we're depressed or stressed or anxious? Anyone? Do you want me to sign?
I can go first.
Okay, thanks, Dr.
Sure. There are different things out there, but for speaking to older adults, I hinted on this during my introduction about many times when we experience stress as people, we might experience it physically. And so maybe you're having more headaches than maybe you really didn't have an issue with headaches prior to all of this, and all of a sudden you have headaches every other day. Maybe you're getting a lot more upset stomach, a lot of GI issues that you're like, I never had this before. Or maybe just more physical pain, different fleeting pain throughout your body. And so pay attention to that. That could be a signal for that your body's given you to say, hey, it's time to use some of those self-care skills that the panelists have been talking about today to really help yourself through the long haul of this. COVID isn't going away anytime soon. And so figuring out some self-care strategies that work well for you, just because it works well for your best friend or a colleague, it doesn't necessarily mean it's good for you too. It's you go through the process of finding what works for you. And so I'd say that is a possible sign that pay attention to the stress that's going on, because it could be just more psychological stress manifesting itself physically.
Or if you're, a hypochondriac and you have a scratch in your throat and you're like, oh no. So I think all of this is really helpful.
That is a real thing too. That is a real thing too.
I thought I had it several times, but I didn't. Okay. So my next question, this is the second to last question. So I'll again, open this up to the panel. We have a lot of people that are having some problems with their children being out, right? And children dealing with this. And so what approaches should you take when you're talking to children about their mental health, because they're affected as well? So there's a two-part of that. And second part, so you can address which one you like, but the second part of that question is, how early is too early to talk to them about mental health issues? Loaded question, but I'll take whomever would like to answer.
Well, I'll start out. I'll leave the mental health aspect as far as the children's age. I'll leave that to Dr. Obide. But I will say that as it relates to COVID, I was talking to a friend and I said something about my son, who is almost 3, about his wearing a mask. And she asked me, does he wear the mask? And I said, yes. And she said, well, how do you get him to keep it on? And I really can't answer that. I think that because he saw, me wear one, he had one that was, made for him. So, it was like, oh, this is your mask. But we go into the stores and he will keep the mask on. And so even again, my trusted source, the CDC, advises, to talk to children about hand washing and the same things that we talk to adults about. So I think that engaging kids as young as possible into these safe practices is extremely important. And I think that with our, not just doing the talk, but also, being an example of that will help the kids to see, well, this is important to mom or dad, then I must need, do the same thing. So I would say, as far as engaging them, that's how I would approach it, or that's how I have approached it with my kid.
Thank you. And Velma, do you want to add on to that? We lost Dr. Obide.
Sure, I'll do that. The one thing I do want to say about children is, yes, you are correct. The question was what age? The age I would say is where they're old enough to understand. And I honestly believe that's around the school age children, because they are going to know once school starts or doesn't start, and they're aware because they had to do virtual, they had to do home assignments, whether it was elementary. So I think the best thing that I can say about children is be honest. And of course, depending on the age, how much do you want to tell them? But it's very clear that there's something going on because they can see people wearing masks, as you stated, Dr. Walker. So I think it is important to let them know there is a virus, this is for our safety. This is what we have to do. And of course, the older they are, I'm sure teenagers, they're talking to their parents about what's going on. I think it's important for parents to make sure they are in touch with their teenagers, just kind of connect with them and see how they are feeling. Because when I sit back and watch and see football practices being canceled and athletes not being able to go to spring training and the graduations, I think back as a teenager and truly, how is it affecting them? And are we asking them how they're doing and how they feel about it? Because it's okay to be angry about it. Seniors, their graduation was very different than a lot of seniors so I think honesty is so important. We can't, we can't have a filter of roses in our glasses and try and tell our kids that. They need to know that this is the reality of our world now. And depending on their age, we don't want to scare them to death, but we do want to be honest with them.
Thank you. And we have Dr. Obide back. Would you like to touch on the question about children and their mental health?
Yes, I'm sorry, I had connection issue, but you might have already.
Welcome to the world of technology.
Yeah, technology. Yes, exactly. You might have touched on this, but again, I think the biggest thing is to pay attention to those signs and symptoms in your children. I mentioned with older adults a moment ago that a lot of older adults may experience psychological symptoms physically, but the same goes for pediatric patients too. The number one reason that brings kiddos to primary care is stomach pain. And so we find that a lot of times the stomach pain anxiety is manifesting as the stomach pain sometimes. So pay attention to that. If you see your kiddo complaining of body aches and pains, that might be a signal to have a conversation about what's going on. And please have that conversation more than once. COVID is definitely a marathon, not a sprint. And so have these conversations with your kiddos as often as you can, especially if you notice things change, things open, they're going to be closing again, they're going to be opening, they're going to be closing. And so they might be really confused, like, wait, I thought we could go to Six Flags, now we can't go anymore. What's going on? So please keep having those great conversations with your children.
Ladies, thank you so much. We are almost at time. Obviously, this is a topic that needs more than an hour to discuss, but I think you did such a wonderful job in getting to, I think, the meat of what we're discussing. Physical and mental health is an issue right now, and we want to provide all the resources possible. So as we mentioned, after this call, you will receive an email with this recording along with the resources that were discussed. And please know that there are all of these locations that these wonderful women represent that you can go in and get some assistance. You can go to University Health System, you can go to Carroll Clinic, you can go to Crosspoint. We also have West Care here in the Eastside and several other entities that are here to provide those type of services. So please know that there are services available and that we want you to be okay. So if we did not get to your questions, please send those to us. This may require a part B. We know that we didn't get to all of them due to the length of time, but we just wanted to make sure that we answered the bulk of them. So if you do have a question, please make sure that you send that over to COVIDHelp, COVIDHELP at sagesa.org or any of our social media platforms. And you can go to those at San Antonio. Now, again, we'd love to thank our panelists. Thank you, Mrs. Gettelman. Thank you, Dr. Stacy Ogbeide. Thank you, Dr. Walker. We know that these are such important topics. And again, just even reading your intros, know that you are very busy women. So thank you so much for your time. I would like to send another thank you to our sponsors again. We have Broadway Bank, BBVA, University Health System, and Frost Bank. So again, San Antonio, please stay safe, stay healthy, and as always, stay Eastside strong. Have a wonderful day.